My honors project is on sleep paralysis. So to begin, we'll discuss what sleep paralysis is. Sleep paralysis occurs just before a person falls asleep, or even upon awakening after sleep, and is characterized by the feeling of being conscious but unable to move. It occurs when an individual passes between stages of wakefulness and sleep. Because they are still conscious, their senses and awareness are intact, but are accompanied by several different symptoms. Sleep paralysis is not life-threatening and not usually linked to underlying psychiatric issues. It is usually just a sign that your body is not moving smoothly through the stages of sleep. Medical attention is usually not necessary unless it occurs regularly, causes anxiety and leads to difficulty falling asleep, or indicates the presence of another disorder. These symptoms may include the inability to move and the inability to speak. Some may experience a feeling of pressure or feel as if they are choking. Hallucinations are common, including visual, auditory, and sensory hallucinations. These hallucinations can lead to intense fear, anxiety, and paranoia during this episode. There are two types of sleep paralysis. If it occurs while you are falling asleep, this is hypnagogic or pre-dormital sleep paralysis. If it occurs while waking up, this is hypnopompic or post-dormital sleep paralysis. Typically, in regular sleep, you lose awareness as you fall asleep, but in hypnagogic sleep paralysis, you remain aware while your body starts to fall asleep and relax. In hypnopompic sleep paralysis, you become aware before a REM cycle has finished. Remember that REM stage is where your eyes move more rapidly and dreams occur, and is where we spend the most part of our sleep in. Sleep paralysis experiences usually fall into one of the three categories. The first category is the intruder, where one believes an intruder is nearby. They may hear sounds of doors opening, footsteps, see a shadow of a man, or sense a threatening presence in a room. The second category is incubus, where an individual experiences signs that causes them to believe they are about to die. This may include the feeling of pressure on the chest, difficulty breathing as if they were being choked or smothered, or even feeling strangled or assaulted. The final category is vestibular motor, which deals with the motor system, where one may experience the feeling of spinning, falling, floating, flying, or even hovering over one's body. Some risk factors that have been linked to sleep paralysis include narcolepsy, which is a neurological disorder characterized by getting an overwhelming urge to sleep and fall asleep at inappropriate times. Sleep paralysis can also be caused by irregular sleeping patterns or lack of sleep. Examples of this include jet lag, or maybe due to working night shift and such. It can also occur by sleeping on your back. And interestingly, it has been seen that a family history of sleep paralysis can put an individual more at risk. It can also be an effect of certain medication, including ADHD medications. It can also be caused by substance abuse, including alcohol, drugs, or even an excess of caffeine. Sleep paralysis can also be a symptom of other medical issues such as depression, migraines, obstructive sleep apnea, hypertension, and anxiety disorders. There is no specific treatment for sleep paralysis, and is usually not necessary either. The best thing to do is to improve sleeping habits by making sure you are getting adequate sleep, which is 6 to 8 hours each night, and making sure your sleep schedule is consistent. It is also important to have a comfortable sleeping environment, reducing light exposure during sleep, and exercising daily. It may also be helpful to treat and address the underlying causes of the sleep paralysis, such as those that regard to your mental health, like depression and anxiety, or other sleep disorders like narcolepsy. So now moving on to some peer-reviewed articles that talk about sleep paralysis. The first study I found was a study called Isolated Sleep Paralysis: Fear, Prevention, and Disruption. And this explores the clinical impact of isolated sleep paralysis by interviewing students to determine episode frequency, fear, and specific hallucinations. They also documented what prevention and disruption methods these students used and how effective these were. They found that those with more recurring episodes had higher level of distress about episodes, and these were the students that tried more disruption attempts. Some methods included changing sleeping positions, changing sleeping patterns, relaxation techniques, changing diet, decreasing caffeine, and exercising. The method with the highest success rate was attempting to move extremities. Moving on to the next article that I found. The article is called The Neuropharmacology of Sleep Paralysis Hallucinations: Serotonin 2A Activation in a Novel Therapeutic Drug. This article proposes a possible mechanism that explains certain symptoms of sleep paralysis. Previous research has shown that hallucinogenic experiences in sleep paralysis are more closely related to serotonergic hallucinations rather than dopaminergic hallucinations. Because of this, they focused on the activation of serotonin 2A receptors, which has been shown to induce hallucinations, be involved with fear circuits, and can cause out-of-body experiences. Because of this evidence, they proposed that this receptor could be responsible for the sleep paralysis-induced hallucinations. Following the explanation of the possible mechanism, a possible drug treatment was also introduced in this article, called pimavanserin, which is a selective serotonin 2A receptor inverse agonist, which would counter the effects of sleep paralysis and essentially stop a large portion of the symptoms. This next article that I found to be extremely interesting and relevant to this class since we have also learned about schizophrenia. This article is called Isolated Sleep Paralysis and Hypnic Hallucinations in Schizophrenia. This article addresses the fact that because isolated sleep paralysis and hypnic hallucinations have an overlap of symptoms with schizophrenia, it is highly unrecognized in these individuals that have been diagnosed with schizophrenia. The goal of the study is to determine the presence of sleep paralysis and hypnic hallucinations in those with schizophrenia and schizoaffective disorder. They found this to be quite difficult because delusional thinking in schizophrenia may be triggered by the sleep paralysis or hypnic hallucinations, and may be hard to identify in these episodes. There is also a possibility that sleep paralysis and hypnic hallucinations coexist with schizophrenia, so even if the hallucinations from the schizophrenia have been treated, it may be mistaken as the patient not responding to the treatment, when in reality it is due to the sleep paralysis. The article indicates that more research needs to be done in this area. I found this topic to be quite interesting and relevant to me personally, as I have personal experience with sleep paralysis, and it has been interesting to learn about the mechanisms behind it, possible reasons why it happened, and possible ways to prevent future episodes.